Welcome to this week's message. As Susanna's away on holiday, it's my turn to do the message this week, and I thought I would try my hand at a podcast. I want to take this opportunity to talk about collaboration, but not just about collaborating across the health and social care system, but across the whole community that the Trust is part of. So I suppose that there's been a number of interactions that we've had with other people showing what they've done in their communities. So Surrey County Council was doing some work with Wigan and Professor Kate Arden. And what that showed was how the whole community was very proud of what it achieved and how it wanted to improve the health of all its citizens and the well-being of all its citizens. And part of that was celebrating the successes. So in Wigan, their big successes were winning the World Cup, winning the FA Cup and winning the Rugby League Challenge Cup. And I think they won that in the same year. And they're very proud of that. And that seemed to be a springboard for moving on and collaborating together and working with each other to try and help each other. And myself and Suzanne then came across Well North. And again, they were really inspirational stories about how communities understood where their problems were and had worked out how they'd help each other and flourish and improve not only the health, but the well-being and the feeling of community and togetherness. And I sometimes am worried that at Ashford and St Peters, we're kind of situated just by a motorway on a roundabout. And we've got to really work out how the community gets to see us as part of their community. And I went to a fantastic event at Brooklands in Weybridge, which was celebrating the maiden flight of Concorde from 1969. And what you then realise is actually you look at Brooklands Museum, who've been instrumental in so many important things in the history of our country, and it's come out of Brooklands. So, you know, the bouncing bomb, aircraft design through the decades, and also they played a very kind of central role in the early stages of Concorde when the first committees met, when they were working out how the French and the British could work together. And it was at Brooklands and in Paris where they had those original meetings in the kind of mid-1950s. And it took till 1969 for the first maiden flight of the British Concorde to fly around. And what an amazing achievement. It was produced by our local community and population, which we've got to celebrate. And actually they set off, and their ambition was to produce a plane, and this is in the 1950s, produce a plane that could travel twice the speed of sound and take 100 people. And that's faster than a speeding bullet. And they achieved that. Not only did they achieve that with the technology they had at the time, so they really used the technology to its utmost, but they produced something that was iconic. And I think that's really brilliant. But we need to do more of that. We need to talk about our community and see how these great inspirational people can help us in engage with technology. And another example is McLaren. Bruce McLaren, who was the first driver really in the, I think it was 1963 when Formula One started. So McLaren have been involved in Formula One and all the technology and all the innovations around motor racing for more than 50 years as well. And again, that's just up the road from us. And, we should be celebrating those kind of things. Woking Football Club, fantastic cup run a few years ago. We've got to talk about this in the hospital and outside the hospital as well, because that's our community that we should be really, really proud of. It's about understanding where health and well-being comes from. And health and well-being comes from being in a community that helps look after itself, to have education which is tremendous for our children, to have housing which is comfortable and warm, and to look after the frail and elderly. And part of that is actually having a flourishing community which has employment for the people who live in our area, and to support those ones who needs care. And I think that's what's been shown by Well North and Wigan, that actually health and well-being is the way we live and work. And actually, if we get that right, then there'll be less need of organisations for us. But we are intricately involved in all the parts of the community that there is. I think we've got to do more. I think we have so many opportunities that we can offer our community in terms of stitching in ourselves with the education of our community and our children. That we are a place where more than 4,000 people work, and we have to look after them and their health and well-being, and how actually we are also part of the environmental issues. So we produce a lot of traffic, we burn up a lot of energy, and we've got to be respectful of that and work out how we can reduce our load on the environment and community as well. So we are completely integrated with the community, and I think we need to understand that and understand the effect that we can have, and also what the community can do to help us and get us to innovate and get involved and be part of us, and also get the general public to let us know, this is what we do, this is what we're about, and everything. This is how we can help and support the community, but also an opportunity for the community to come in and say, well, have you thought of doing this? Did you know this? We're doing this. We can help or support and things like that. So a two-way street. And this is something, open days for hospitals used to be something that was done hundreds of years ago, to see actually that we're doing our part in the community and our job right, to looking after people. But I think it's a much more integrated approach there. We need to harness the innovation and the talent that is in our community to help us move forward through the 21st century, and take the opportunities in terms of technology and healthcare delivery that will be available to us. I think most of the education that we're doing at the moment is linked around educating our staff. And what we have learned is that actually if the staff learn together, so if they don't learn in isolated groups, but they learn together in teams, actually that creates bonds and friendship as well as combined learning going forward. So it's much more enjoyable to do it that way, and also it's much better for the product that you end up with at the end. Actually, we should do more of that learning in conjunction with the community as well. Help us attract a workforce of the future from our school. And we have great opportunities in schools and school children to learn about physiology and anatomy and health and well-being, or even things like the environment and energy and mechanics and things, which are all part of running a hospital in our schools. And what we need to do is link up, so we're with them. I think what we're on the journey of is realizing that there's lots of people that we need to engage, talk to, communicate with, take advice from, take support from, that we didn't realize before. And I suppose our eyes have been opened a bit to working much more closely with the council, the districts and boroughs, as well as social care and community care, and as well as the citizens as a wider group. And I think that if people have ideas or suggestions of, well, how can we find out what does the community really need from us, and how should we organise ourselves to help the community, and that's what we need to hear, rather than us deciding something within our four walls, which may or may not be the right thing that the community feel that they need. So I think we're open for people suggesting what we should be doing and the way we should be doing it. Thank you for listening, and I hope you all have a lovely Easter weekend. I recognise that many of you will be working hard through the Easter period, but I hope you do have some time to spend with your family. And please do get in touch if you have any further ideas of how we can engage and get involved in our local community and find out what they need from us and how we can help them further. Thank you.